Okay, so today we will be discussing the grand challenges for ensuring healthy development for all youth. This topic focuses on improving behavioral health outcomes and overall development for young people from birth throughout early childhood and early adulthood. This issue is especially important because early experiences play a major role in shaping long-term outcomes, including mental health, education, and economic stability. When youth do not receive the support they need early on, the effects can continue throughout their entire lives. In this presentation, we'll be focusing on understanding the social condition behind this issue, why it matters, who is most impacted, and how addressing it contributes to a more just society. So the overview of our grand challenge is part of a larger national initiative created by the American Academy of Social Work and Social Welfare. Its main focus is on preventing behavioral health problems before they begin. The challenge targets youth from birth through age 24 and emphasizes early intervention strategies that support healthy emotional, social, and cognitive development. Instead of waiting until problems become severe, this approach focuses on prevention and early support. Another key component of this challenge is reducing disparities. Not all youth have equal access to resources, and this initiative aims to close those gaps by promoting equitable access to services and support systems. So the issue of this challenge is behavioral health problems in childhood and adolescence taking a significant toll over a lifetime. The issues can affect mental and physical health, relationships, and overall life outcomes. Research shows that these problems are linked to lower economic independence, increased risk of chronic illness, and reduced quality of life. However, there is also strong evidence showing that many of these issues are preventable with the right interventions. The goal of this challenge is to reduce behavioral health problems among youth by 20% within a decade. It also aims to reduce racial and socioeconomic disparities by 20%. To reach these goals, the initiative focuses on expanding access to evidence-based prevention programs and increasing investment in early intervention. So why it matters? This issue matters because the effects of behavioral health challenges extend far beyond childhood. Youth who experience these issues are more likely to struggle academically, face difficulties in the workforce, and experience ongoing health problems. Even though prevention strategies are proven to be effective, they are still not widely implemented. Many young people only receive help after their challenges have already become severe. By focusing on early intervention, we can reduce long-term social and economic costs while also improving quality of life for individuals. Prevention allows us to address problems before they escalate, which leads to better outcomes overall. In creating a more just society, it's important to address the grand challenge because it reduces disparities in access to care and outcomes. Currently, youth from marginalized backgrounds often face greater barriers to resources such as healthcare, education, and community support. This initiative works to create equal access to these resources and promote fairness in outcomes. It ensures that all youth, regardless of their background, have the opportunity to develop in a healthy and supportive environment. By reducing inequality and increasing access to support, this approach strengthens communities and promotes long-term social equity. The population and social condition. The population is most affected by this issue includes children, adolescents, and young adults from birth through age 24. However, the focus is especially on youth from marginalized and low-income communities. The key social condition involved is limited access to behavioral health prevention programs and inequities in healthcare and support systems. These barriers often exist in under-resourced communities where services are limited. As a result, youth in these environments are more likely to be exposed to risk factors such as poverty, stress, and lack of support, while having fewer protective resources available. So those impacted includes groups that are disproportionately impacted by the issue, including youth living in poverty, youth of color, and families with limited access to healthcare and social support systems. Communities that lack mental health services also experience higher rates of behavioral health challenges among youth. These disparities are largely driven by structural inequalities, meaning that access to resources and opportunities is not evenly distributed, creating unequal outcomes across different populations. So the long-term impacts is when the issues are not addressed early, they can lead to long-term consequences that extend into adulthood, including chronic mental and physical health conditions, lower levels of education, and reduced career opportunities. There is also an increased risk of substance use and involvement in the criminal justice system. Over time, these outcomes contribute to ongoing cycles of poverty and inequality. This is why prevention is important, helping break the cycle before they become long-term patterns. Short-term impacts include increased anxiety, depression, and behavioral issues among youth. These challenges often appear in school settings where students may struggle academically, have difficulty concentrating, or experience behavioral problems. Family stress can also increase, which creates instability in the home environment. These early challenges can disrupt normal development, but they're often preventable with early intervention and support. So, our condition statement says youth in marginalized communities face higher risks of behavioral health challenges due to limited access to prevention programs and supportive resources. In the short term, this leads to emotional, behavioral, and academic difficulties. In the long term, it results in significant disparities in health, education, and economic stability. Addressing the issue through early intervention and equitable access to resources is essential for improving outcomes and creating a more just and supportive society.
Now we're going to talk about systems shaping the social condition. As we move into assessment and intervention planning, it's important to understand that marginalized youth are not operating in isolation. Their experiences are shaped by multiple systems that reinforce one another. First, racism plays a major role, especially through what is known as the school to prison pipeline. Students of color are disproportionately disciplined and pushed out of educational spaces. Instead of being supported, they are often criminalized, which limits their opportunities early on. Second, adultism and ageism also impact youth. Many systems exclude young people from decision making even when policies directly affect them. This is especially harmful for youth who are already vulnerable, such as those in foster care or experiencing homelessness. Finally, economic inequality is a major factor. About 1 in 5 children in the US live in poverty. This isn't random. It's tied to long standing barriers that limit access to stable jobs, quality education, and resources for families. Together, these systems create a cycle that keeps marginalized youth at a disadvantage and directly contributes to the behavioral health challenges we discussed earlier. Next, we're going to talk about theories and research. To understand why these conditions exist, we have to look at both historical and current factors. Historically, policies like redlining and job discrimination prevented many Black and Brown families from building wealth. That impact didn't disappear. It continues to affect communities today through underfunded schools and limited access to resources. On a socio-political level, we also see policies that criminalize social issues. For example, homelessness and substance use are often treated as legal problems rather than health concerns. This creates what's called a homelessness jail cycle, where youth move between unstable housing and the justice system. These conditions are maintained through systemic patterns like normalized violence toward marginalized groups and lack of investment in certain communities. Research helps back this up. The framework of intersectionality shows that overlapping identities, such as race, sexuality, and disability, can increase vulnerability. Data also shows that around 4.5 million youth experience homelessness each year, with youth of color and LGBTQ youth overrepresented. So, overall, the research makes one thing clear: these issues are structural, not individual. Next, we're going to look at interventions, what works and what doesn't work. Based on this understanding, we can look at interventions. What's currently working focuses on prevention and support rather than punishment. One example is family focused prevention. Programs that support families early on can reduce the need for more intensive mental health interventions later. When families are stable, youth outcomes improve. Another effective approach is smart decarceration. This involves reducing incarceration rates and focusing on reintegration instead. It helps break cycles of poverty and prevents long term harm. However, not all interventions are effective. One major issue is narrow service definitions. Many youth don't qualify for help simply because they don't meet strict criteria. That leaves a large group without support, even when they clearly need it. Another problem is punitive reform. Some systems claim to improve outcomes but still rely on surveillance and control. For example, child welfare systems may continue to monitor and separate families rather than addressing the root causes like poverty. So, the key takeaway here is that supportive, preventative approaches work better than reactive, punitive ones. Next, we're going to look at the hypothesis. Based on everything we've discussed, we've developed two key hypotheses. The first hypothesis of etiology, which explains why these occur. This hypothesis argues the negative outcomes like homelessness, incarceration, and poor health are not the result of individual choices. Instead, they are caused by a combination of historical structure, inequality, and ongoing institutional control. In simple terms, communities have been deprived of resources over time while also being heavily monitored by systems like schools and child welfare. This creates a situation where youth are more likely to be pushed into systems like the justice system. The second is working interventions hypothesis, which focuses on solutions. This hypothesis suggests that if we shift from reactive approaches like punishment and removal to preventative support, we can improve long term outcomes. That means investing in things like direct financial support, community based programs, and restorative practices in schools. The idea is that stabilizing a young person's environment is more effective than trying to fix the individual. Success wouldn't be measured by reduced negative behaviors, but by positive outcomes like better education, stronger relationships, and overall well being.
All right, so the program, part three. So we've named the program the Youth Strong Development Program. This is a community-based youth development program designed to support healthy development among adolescents and underserved communities. This program addresses key barriers such as limited access to mental health services, lack of mentorship, unstable family systems, and insufficient community support. Next are the program goals. So, the goal of this program is to promote healthy emotional and social and academic development in youth. Um, and this is achieved by strengthening protective factors that support long term well being and resilience while reducing risk behaviors strategies. So, this program uses trauma-informed, strengths-based, and strengths-based and community-centered approach. It builds supportive relationships through mentorship, school collaboration, and family engagement to create a consistent support for a system for the youth. And the objectives. So, the main objective of our Youth Strong Development Program include improving youth mental health outcomes, increasing school engagement, strengthening coping skills, and improving the family support systems. And so for the program activities, the program includes weekly mentorship sessions, after school enrichment activities, life skill training workshops, mental health support groups, and family engaging support systems. Um, these activities do provide consistent support to promote positive youth development. And then for the beneficiaries, so the primary beneficiaries of the Youth Strong Development Program are around ages 12 to 18, living in underserved communities who may face limited access to supportive resources and developmental opportunities. The secondary beneficiaries include families, schools, and community organizations, as the program contributes to improve the youth outcomes, stronger family engagement, and then overall community stability. And then next, um, social social justice impact. So this program promotes social justice by addressing systemic inequalities in access to youth development resources. It works to reduce opportunity gaps by providing free community-based services that ensure equal access to mental health support, mentorship, and educational resources. By targeting underserved communities, the program promotes fair and inclusive youth development and addresses broader structural barriers that impact long term outcomes. So, our logic model. So, this logic model illustrates the youth development program that it creates change through a structured flow of inputs, activities, outputs, and outcomes. So, starting with the inputs, the program relies on trained staff, funding, community partnerships, and access to program facilities. These resources make program implementation possible and sustainable. And then next are the activities, which include so yes, starting with the wait, sorry, I got distracted, my kid. So yeah, next are the activities, which include the mentorship sessions and after school programming, life skill workshops, mental health supports, and family engaging events. These activities lead to outputs, which are the immediate measurable results, such as the number of you served, the number of sessions held, and then attendance rates. And then finally, the outcomes represent the long term changes, including improved mental health, increased school engagement, and stronger coping skills among youth. So, overall, this model demonstrates how structured investment in resources and services leads to measurable improvements in the youth well being. And then for the evaluation plan, so the program will be measured through both process and outcome evaluation. The process evaluation will include attendance rates, participation levels, and satisfaction surveys. The outcome evaluation will assess improvements in school performance, mental health indicators, and behavioral changes. And the data will be collected through surveys, school records, attendance logs, and staff observations. And references.
All right.
Sorry, I had an interruption.